This won't be a long video because you're in pain. When you're in pain, you don't want fluff. You want solutions. You need actionable steps that you can take today. This topic is very personal for me. I was born with scoliosis, and I've dealt with severe lower back pain for about 15 years. I've been caught in a cycle of re-injury, sometimes from being young and reckless, sometimes from well-meaning but bad advice, and sometimes from just plain old bad luck. But that's enough about me. Let's dive in to what really works to build a stronger, more resilient lower back. Advice number 1, stop stretching and start stiffening. Ah yes, the old stretching myth with lower back pain. Oh, you've got lower back pain. Your hamstrings must be just super tight and that's causing all your lower back pain. I need you just to stretch your hamstrings till the cows come home. Wrong. You might have tight lower hamstrings, but that's not necessarily correlated with how much lower back pain you're having. The two don't go hand in hand all the time. If anything, spending time in that awkward rounded forward flex position with all the little hamstring stretches actually probably did more harm to my back than good, because I'm kind of hypermobile anyway. That's kind of the opposite of what I needed to focus on. Yes, my hamstrings are tight, but most of my body's really loose. I'm long and lean and kind of flexible. I would say most people with lower back pain need to spend less time stretching, more time stiffening. What do I mean by that? Strengthening the muscles around the abdominal wall, like all around the abdominal wall, the extensors of the back, the tiny little extensors of the back, and all the abdomen, maybe even the legs, just the total body strength. That way you have good intra-abdominal pressure. You can hold everything nice and stable. The wind can't blow you over back and forth. If you're holding everything nice and stable, you're not going to get your back in these little facet joints and all these little awkward angles, and it's not going to irritate your back. If you hold everything nice and stiff like you're supposed to, then that's going to reduce the pain in your lower back. Your spine is supposed to function as a stiff and rigid, kind of flexible rod. Yes, it can bend, but it's not really designed to have all these huge bends over and over and over from all these weird angles. You're actually supposed to do most of your movement with your shoulders, with your hip joints, by hinging. You're supposed to hinge when you bend over to pick stuff up off the floor rather than around the back. One easy method for stiffening the core, and we'll get to plenty of exercises, is learning the abdominal brace. We don't need that weight belt. We've got our own brace with our core. Rather than sucking your gut in to brace and tighten it up that way, it's much better to expand your stomach outward, as if someone were going to punch you in the stomach. You don't want them to be able to knock the breath out of you. So you kind of blow out, and your stomach and core should be expanding outward and away from you. Tune the bracing to the task. It's not as simple as you brace your core as tight as possible for each little task. You tune the brace to the task. Picking up a 50-pound bag of dog food, it's quite a bit of pressure. Pretend like Iron Mike Tyson's about to give you a freaking hook into the stomach. You don't want him to kill you, do you? You get my point. We're keeping this simple, 10,000 foot view. Advice number 2, you gotta develop a walking routine. When you're in the beginning stages of dealing with lower back pain, the simplest thing that I want you to start doing is developing a walking routine. Don't overcomplicate this. I'm talking 1 to 3 short walks a day. So we're not training for a marathon. Start with 5 minutes if you have to. Maybe build your way up to 30-minute walks, 3 30-minute walks a day. But don't start with that. Even if you just have 1 short walk a day, that's a win. We're trying to desensitize your lower back to pain. When you're walking, it should not hurt. Once it starts hurting, that's your cue to take a break, time to stop. You're not going to gain it all back in one day, folks. When you're walking, walk like you mean it. Kind of walk pretty fast. We're not necessarily speed walking, but we're not just strolling either. It actually takes some pressure and some load off your lower back if you walk kind of with a purpose, like you have somewhere to be. Walk like you're important, you know? Kind of lead with your chest as you walk. So don't walk all hunched over, lead with your chest. A simple walking routine can get you out of intense pain. We're trying to decrease the amount of pain you're feeling. Before you begin like strength training, you first need to get yourself out of acute pain. Breakthrough number 3, buying a back extension and putting it in my house. This one is so important, I've actually got it in my living room at my house. I do it pretty much every day. That way I have no excuse to not do it because it's right beside of my recliner where I do my daily notes. So essentially it's a way to strengthen the extensors of the spine without irritating them. The thing I like about this is you can grade it up and down super easily. For example, like we're going to start with isometric strengthening, then we're going to progress to spinal flexion, extension after that. You can even do quadratus lumborum strengthening. It's going to be an isometric hold. So most people would probably start out around 20 seconds because you're going to be really sensitized to back pain when you're starting this originally. But the goal would be to eventually be able to hold this position for 2 minutes. If you can do that, then you can progress to the next portion of the exercise. But I'll just show you what it looks like to start with. I kind of like to cross my arms like this. That helps me kind of retract my scapula. I'm engaging my glutes, but not so much that I don't feel it in my lower back. Because what I like about this is you're actually using your lower back muscles. So for people who are afraid to use their back, this is a good one to try. So you got your holds here. Your goal is 2 minutes eventually, but don't force it. If you have to like shake and give it all you got to get the 2 minutes, you're not ready yet. Once you can get 2 minutes, then you can progress to the next one. Feel free to use the handles to support you. Once you can get 1 to 2 minutes, somewhere in that range, progress to 1 leg holds. So kind of take 1 leg off, use your hands if you need to, but that puts a little bit of torque on your spine, requires more core stability to do that one. And then obviously switch to the other leg. Kind of the goal with that one is 1 minute. So you got 1 minute on one side, 1 minute on the other side. Once you can do those really well, then you're ready for actual spinal flexion extension. Take note of where this is positioned. Most machines adjust, so you can go up or down depending on how hard you want to make it. Go all the way down, all the way up. All the way down, all the way up. So it's controlled spinal flexion. If you're like me, you're probably one of those people that was afraid to bend your spine down and up. This is an easy way of doing it without pain for most people. The goal with this one is about 20 to 30 reps once you get really good at it. But obviously, everybody's got a different starting point, so don't try to jump right into 30 reps. But in my opinion, once you're able to do like 30 in a row of these, you're going to have a pretty strong back by then. So spinal flexion really can flare you up if you're not careful. But there's something about this machine, the position where it holds your hips, that really feels good. You can really get a good lower back pump with this exercise. Another thing you can do is get a really good hamstring stretch with this one. So like a lot of people have tight hamstrings that have back issues. It's just kind of one of those things. It doesn't mean you necessarily do, but a lot of people do. So just reach all the way down and kind of hang out at the bottom. You can do like a 30-second hold, a 1 minute hold, whatever you want to do. Easy way to stretch out your hamstrings. Then the quadratus lumborum is a really common muscle that gives a lot of people problems. If you've got pain running from here to your hip on one side or the other, you can likely thank your QL for that. So it's like the other ones. You start with the ISO hold. I mean, I can feel this right here because I've messed my QL up in the past. So you start with the ISO hold. If you're pretty comfortable with that, you can kind of go down and up with it. And then obviously you can change sides, down and up with it. You can do that. You could kind of hold your arms out to get an even further stretch with it. But as you can see, those are pretty challenging for me. So like those are tough ones, but they're good ones. Breakthrough number 4, the McGill Big Three back exercises from the book, The Back Mechanic. Excellent read. The first one that's helped me a lot is isometrically strengthening the core, like we've already talked about in a bunch of other parts of this video. We're going to do 3 versions of a plank. So the goal is 10 seconds one side, 3 seconds middle, 10 seconds the other side. So we'll pick a side, we'll pick the right side up and we'll do a 10-second hold that way. I'll go ahead and go for the sake of the video. Roll into a regular plank, hold that at about 3 seconds. Switch to the other side, hold that 10 seconds. Then you'd go back to the middle and go back to the side. You'd repeat that 4 times. So do that 4 times in a row, take a 30-second break, do that 2 more times, take a 30-second break, do it 1 more time, and then take a 30-second break. That's a great one, and if it's too hard for you, All you gotta do is not lift your hips up. Just start kind of like that. That's the way of grading this one down. And then on your knees and on your knees. That's how I started. That's how a lot of people have to start. If it's causing back pain, that's what you got to do. So next one is called a bird dog. It's going to be opposite arm, opposite leg. So go out away from you. 10-second hold. I'm trying to drive my heel through the wall. I'm making a good tight fist up here. And now I'm going to come back together like I'm scrubbing the floor. And then go right back out. Be wary of doing this. We're not doing that. We're trying to keep the core nice and stable, and we're pushing out. Practicing that same abdominal bracing technique I showed you earlier. Four times on that side, then we'll go ahead and switch to the other side. So you do the same thing on the other side, and then back together. So that's a way you can do that one. And the 10 seconds holds is just what I do. That's what I've built up to. That's what he recommends in his book. You can totally start with less seconds than that if it's too challenging for you. Okay, this one's called the modified curl up. You're going to want to lay down on a firm surface. Either the floor or a firm bed like we've got here is fine. Bend both legs up like this. Straighten one leg out. Take both your hands, place them underneath your lumbar spine. Raise your elbows up off the table. Here's the trickiest part to get right. It's not a crunch, but it's similar to a crunch. Crunches can irritate your back. This one will not if you do it right. Pretend like there's a weighted scale underneath my head. And my head weighs 30 pounds or whatever it weighs. And I'm gonna try to unweight the scale. And I'm gonna do that while doing my abdominal bracing technique I did earlier as well. So I'm gonna curl up and kind of slightly lift my head off the table, just very slightly. Tense up my core, raise my leg up, and it's way harder than it looks. Do a 10-second hold, and go right back down. And we're gonna do another one. So again, I'm unweighting my head from the table, even my upper back a little bit, and just kind of tensing up. There's tons of tension in my abs when I'm doing this. And my spine is not moving a whole lot, so it's staying protected. The bed's helping me with that. My hands are helping me with that. Then you switch sides. So kind of like that. And then we'll do it again on the other side. So, and again, with those, I would do 10 seconds 4 times on one side, 10 seconds 4 times on the next side. Take a 30-second break. Then I would do 10 seconds for 2 on one side, 10 seconds for 2 on the next side, take a 30-second break. Then I would do 10 seconds for 1 on one side, 10 seconds for 1 on the other side, then I'm done. So, and the cool thing about all of the ones I just showed you is that you can do them every day. You're probably not gonna be strong enough starting out to do them every day, but once you get kind of used to these, you can do them every day. Kind of like brushing your teeth for your back. And philosophy number 5, avoid daily micro injuries. So one philosophy that I've kind of had to really change, that's been the hardest part to change, is like your lifestyle. So I had to kind of go through my entire day, analyze what positions typically cause me pain and kind of make corrections to that. For me, it was sitting, driving, bending over to put on shoes and socks, getting out of bed in the morning, drying my legs off when I got out of the shower, throwing away trash, all kinds of like weird little positions would really irritate my back. The one philosophy that I started adopting that helped me kind of get through that was that I imagined I had an open wound in my back. And every time I was doing something that kind of caused pain, I looked at it like I was picking at an open wound. I was picking the scab off the open wound. And I realized that like every time I was doing that, I basically was injuring my back. I was kind of hard-headed and pushed through pain for most of my childhood and really paid for that when I turned about 23, because then I was just getting to where I couldn't do much. So by adopting that mindset of looking at it like an open wound, I took it more seriously and was able to make corrections. Now, it's impossible in one video for me to help you dissect everything you do during your day that causes pain, but that's the way I want you to start thinking. It is worth it. You're not going to out-exercise bad habits. It is definitely worth taking the time to look at the stuff you're doing on a daily basis that's flaring you up and either changing the way you're doing it or stop doing it. One other thing I'll leave you with is the pain gate theory. So let's say you've got like a gate or something. You want to flood the gate with sensations that doesn't hurt. If you're flooding that gate with sensations that hurt, you're sensitizing your back to pain. So let's say every time you bend over to put on socks, it hurts. If you do that over and over and over, you're reinforcing to your brain that that hurts over and over and over. Now, if you figure out a strategy to put on your socks with no pain, and you do that over and over and over, then you're reinforcing that you can put on your socks without pain. And before you know it, you don't have to think about every little thing you do because your back becomes less sensitized to pain. So it is worth thinking about all those things.